Over the past 5 months, 11,106 suspected dengue patients have been reported from the island, with 60% being reported from the western province. There are 4 stages through which the dengue virus can be clearly identified and is spread by the Aedes aegypti and Aedes albopictus mosquitoes. There is a risk of dengue spreading as an epidemic in Southeast Asian countries, including Sri Lanka. The Ministry of Health says that during the months of June, July, November and December, which are the months after the monsoon season, an increased number of dengue patients are reported. Yesterday, research by the University of Kelaniya highlighted a change in the active pattern of the dengue mosquito.
මදුරු වගේ දෂ්ට කිරීමේ කාල වකවානුව දින දවසක් ඇතුළත උදේ 7යි 9.
What we used to know earlier is that the dengue mosquito is active from 7 a.m. to 9 a.m. and from 3 p.m. to 5 p.m. However, the research that we have conducted goes to show that the mosquito is active from 10 a.m. to 12 noon and from 2 to 4 in the evening. So there's a change in the active pattern of the mosquito. So far, we were only aware that the filaria mosquito breeds in wastewater. However, there is a spread of dengue mosquito larvae in unclean water in addition to filaria mosquito larvae. We have seen mosquito larvae spreading in paddy fields and wells.
කුඹුරු වල එකතු වන ජලය එහෙමත් නැත්නම් ගොඩක් වෙලාවට ලිඳවල් ආශ්‍රිතව මෙම මදුරු වගේ ගහණය ව්‍යාප්ත වෙලා තියෙනවා කියන එක.
The Ministry of Health says that dengue continues to spread within the western province as an epidemic. The National Dengue Eradication Unit has taken measures to distribute chemical supplies to areas that are high at risk of dengue in a bid to destroy dengue mosquito larvae. The Ministry of Health pointed out that the increased number of mosquito breeding grounds and unclean households has attributed to the increase in dengue patients during the past month. This morning, a Newsfirst team toured the city of Colombo and its suburbs to witness the claims made by the Ministry of Health. The Newsfirst team was able to witness a drained water system that was a breeding ground for mosquitoes and several garbage dumps that favor mosquito larvae.
ඩෙන්ගු රෝගය සීග්‍රෙන් පැතිරී යන ප්‍රදේශ ආශ්‍රිතව පවතින රෝහල්වල බාහිර රෝග.
The Ministry of Health has taken steps to implement a program to separately treat persons contracted with dengue in areas where dengue is on the rise.
හත් ප්‍රමුඛතාවය ලබා දීමටත් කටයුතු කරලා තිබෙනවා.
The patients who are coming with the fever to be examined separately and then get their blood tested done within a very short period of time. So this will really facilitate getting more attention for the patients who are coming with fever and dengue patients. So therefore, with the discussions we are going to have tomorrow with the hospital directors and hematologists who are in charge of the laboratories, we might be able to establish these services from tomorrow itself.
ඩෙන්ගු රෝගය ව්‍යාප්තිය.
Does the responsibility of preventing the spread of dengue fall on the shoulders of the Ministry of Health or the local government institutions?
ආයතන සතු වගකීම කුමක්ද?
So Ministry of Health has taken all these measures to ensure that the patients who get dengue fever get a very much better deal. And at the same time, prevent and control spreading of dengue fever, the ministry is working with all the other necessary government agencies as well as other ministries.
112 dengue patients are receiving in-house treatment at the National Hospital in Colombo at present. Deputy Director at the hospital, Dr. Cyril De Silva, said that 25 patients are suffering from dengue hemorrhagic fever. The number of patients being admitted to the Colombo South Teaching Hospital has gradually increased. Director of the hospital, Dr. Asela Gunawardana, said that 180 persons, including 2 nurses, were receiving in-house treatment at the hospital as of last night. 75 children who had contracted the dengue virus are receiving treatment at the Lady Ridgeway Hospital. Around 100 dengue patients are receiving treatment at the IDH hospital, and among them are 1 PHI officer and 2 junior staff attached to the hospital. Meanwhile, a doctor who had contracted the virus is receiving treatment at the East Colombo-based hospital.